Okay, I'll begin today by washing my hands for 20-30 seconds thoroughly, then I'll close the curtain for privacy. All right. Hello, Nicholas. My name is Valentina, and I'll be your nurse today. How are you today?
I'm good.
It's very nice to meet you, Nicholas. All right, Nicholas. Let me see. Can you please tell me what your name and date of birth are?
I'm Nicholas Volko, and I was born on September 20th, 2007.
Very good. Excellent. All right, Nicholas. Now, can you tell me, where are we?
At the hospital.
Very good. Excellent. What day is it today, Nicholas?
July 10th.
Excellent. Very good. All right, Nicholas. Now, can you please shake my hand? Very good. And can you squeeze it for me? Excellent. All right, Nicholas. You are alert, oriented, and awake ×3, which is excellent. Now, Nicholas, I see that you are responding to my cues verbally, and you are very responsive. Your eyes are also wide open, which means that your Glasgow Coma scale is 15. All right. Now, Nicholas, have you had any allergies?
No.
No? Okay. Are you currently taking any medications,
No.
whether that's over the counter, no herbal supplements? Okay. No prescriptions.
No.
All right, Nicholas. Now, can you tell me, let's see, do you have any past medical history that maybe I should be aware of?
No.
Okay, perfect. Now, what brings you in today, Nicholas?
I started seeing blurry
Okay, so you've had some blurry vision. Okay, Nicholas, when did you first notice this blurry vision?
about 5 days ago.
5 days ago. Okay, Nicholas, and what were you doing when you noticed this blurry vision?
I was watching TV.
You were watching TV. Okay, Nicholas. Now, can you describe what you mean by blurry? Are you having trouble seeing things that are far away, closer?
Far away.
Far away. Okay, Nicholas. And have you had any other symptoms along with this, like headaches?
No.
No. Okay, perfect. Okay, Nicholas, now can you tell me what makes your vision better or worse? Are you using corrective lenses?
Glasses.
Glasses, corrective lenses. Okay. Now, have you experienced any itchiness, redness, drainage in your eyeballs?
No.
No? Okay. All right, Nicholas. Well, today we're going to begin by taking your vital signs. So I'm going to begin by taking your pulse. I will palpate your radial artery, and I will make sure that your pulses are 60 to 100 pulses per minute. This I'll assess for 60 seconds, and yours are actually 80, so they are perfect. Next, I will assess your respirations. Your respirations, one full breath is your chest fully rising and fully falling, and this should be between 12 to 20 breaths per minute. All right, Nicholas, yours are 16, so that is perfect. Now I will assess your temperature, Nicholas. I will place this probe inside of your mouth, and I'll place it slightly away from the center under your sublingual sac. Please put your tongue down and close your mouth, Nicholas. All right, Nicholas, please keep this probe until it beeps. Beep. Your temperature, Nicholas, should be between 96.5 degrees Fahrenheit to 99 degrees Fahrenheit, and yours is 98.6 degrees Fahrenheit, which is perfect. All right, now we'll take your blood pressure. So for your blood pressure, I'll use the two-step method. I'll place a cuff on your arm. I will place it 1 to 2 inches above your brachial artery. All right, then I'll feel for your radial artery pulse. And once I have felt this pulse, I will begin inflating the cuff until I no longer feel the pulse. I will note on the gauge of the sphygmometer the number at which I no longer felt his pulse. Then I will deflate the cuff, and I'll let his arm rest for about 1 minute. I will then use the stethoscope. I'll place the earpieces anteriorly, and I will place the diaphragm of the stethoscope on his brachial artery. I will then inflate the cuff about 20 millimeters of mercury above the number I had previously noted. I will listen for 2 sounds. The first will be the systolic, and this will be the first sound, and then I'll listen to the last sound, which will be the diastolic. His blood pressure should be no more than 120 over 80, and it should be no less than 90 over 60. Yours is 110 over 70, which is perfect, Nicholas. Now I'll continue on to measure your pulse oximetry. I'll place this probe on your finger, and this will give me a reading. Your pulse oximetry should be no lower than 95%, and yours is 100%, which is excellent. Next will be capillary refill. This will test your circulation, Nicholas. So for this test, I'll assess your skin, which should be in accordance, your color should be in accordance to your ethnicity, which I see that it is. Next, I will test capillary refill by pressing down on your fingertips for blanching, and your color should return within 2 seconds, which it does. Lastly, I will place the dorsal aspect of my hand against your forehead, against your skin to feel for your temperature, and you are warm and dry, Nicholas. Excellent. Now we'll go on to your pulses. So pulses should be between 0 to 3. That's the scale. 0 would be no pulse, and this should be confirmed by a Doppler. 1 would be considered a weak and thready, 2 would be normal, and 3 would be a bounding pulse. First, Nicholas, we'll assess your temporal, which is on your temples. Next, we'll go down onto your carotid pulses, which are on either side of the trachea. These should be assessed 1 at a time. Next will be the apical, which is in the center of the chest, slightly above the heart. Next will be the brachial pulse, which will be on the medial aspect of the elbow. The radial pulse is on the thumb side of the wrist, and the femoral will be in between the legs on the aspect of the groins. Next will be the popliteal. So this one we'll find behind the knee. Then we have the posterior tibial, which is on the medial side of the foot, of the malleolus. And lastly, at the tip of the toe, of the big toe, you'll find the dorsalis pedis or pedal pulse. Next, Nicholas, we'll be assessing your thyroid. So for your thyroid, I'll be using the posterior approach, Nicholas. I'll be standing from behind, and here's a glass of water for you. Just so that you know, Nicholas, I'll be touching your neck from the back. So for this test, I'll palpate the right side. This I'll do by slightly displacing the trachea with my left hand. Can you please take a sip of water, Nicholas? Very good. All right. I'm feeling for your swallow. Normally, I should not feel anything. The same should occur on the other side. However, the right side always tends to be anatomically larger. All right, Nicholas. Now we'll be assessing your cranial nerves. So for your cranial nerves, Nicholas, we will begin by assessing your first nerve. So the first nerve, Nicholas, is your olfactory nerve. And this olfactory nerve, Nicholas, is a sensory nerve. So this tests your sense of smell, Nicholas. For this one, I need you to please check, we'll be checking your patency. So I need you to please cover your right nostril. Very good. And I'll need you to close your eyes for me, Nicholas. I need you to please smell and tell me what you smell.
Vanilla.
All right, now can you please cover your other nostril? Excellent. And can you inhale and smell this?
Chocolate.
What do you smell? Very good. Chocolate. All right. Next, Nicholas, we'll be assessing your optic nerve. So for this nerve, this is the second cranial nerve. This is a sensory nerve, and we'll be testing your vision. So I need you to please stand, Nicholas. Okay, we'll be performing the Snellen test. For the Snellen test, I'll have Nicholas stand 20 feet away on a line, and I'll be holding the Snellen chart. Nicholas, I'll need you to please cover one eye, and I'll need you to please read the line that you can read the clears for me.
A76
Very good.
G32.
Excellent. All right, Nicholas. All right, you can have a seat for me. Nicholas, your vision is 20/40, which means that what you see at 20 feet, the average person would see at 40 feet. This means that you are slightly nearsighted, which shows that you're having difficulty seeing objects that are far away. An average person would have 20/20 vision. So then, now, Nicholas, we can continue on to your next nerves. Also, this Snellen test should be performed on the other eye as well, and it should also be performed with both eyes open. So, Nicholas, for our next test, we're going to be testing your third, which is your oculomotor nerve, your fourth, which is your trochlear, and your fifth, which is, your sixth, which is your abducens. So, all of these are motor in function, and we will test this to see your eye movements. We will examine your pupils for their size, their shape, and their equality. For this test, Nicholas, let me grab my pen light. I will need you, Nicholas, to please keep your head still, and I'll need you to please follow my pen light with your eyes only. So I'll be holding onto your chin to avoid you from moving your head. So we'll go to the right and up, and back to the center. We will go to the left and down, and back to the center. We will go to the left and up, back to the center, right and down, back to the center, laterally to the center, and then laterally and back to the center. Very good. All right, next we'll be assessing your trigeminal, which is your fifth cranial nerve. This is both sensory and motor, and it tests facial sensations. So for this test, Nicholas, I will show you what sharp and dull feels like with this instrument. So this is sharp, and this is dull. Okay, Nicholas. Now I need you to please close your eyes for me, and I'll need you to tell me what you feel, whether it's sharp or dull, and please point to where I touch.
Dull. 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 Dull.
All right, very good. Excellent, Nicholas. Now we will test your seventh cranial nerve, which is the facial nerve. This one is both sensory and motor in function as well, and it tests your facial expression. So, Nicholas, can you please smile for me? Can you please frown for me? Frown. There you go. Purse your lips. Very good. And can you please puff your cheeks? Very good. Excellent. Now we'll continue on to your eighth cranial nerve, which is the vestibulocochlear nerve, or your acoustic nerve. This one is sensory in function, and this one deals with hearing and balance. So the transmission of sound and equilibrium from your inner ear to your brain. All right, Nicholas, for this test, I will need you to please stand. I will be performing the whisper test. I'll need you to turn around, Nicholas, and I'll be standing 2 feet away from you. Please cover your tragus. Very good. Excellent. All right, I'm going to whisper 3 words. Chocolate.
Chocolate.
Vanilla.
Vanilla.
Girl. Very good. Excellent. Nicholas, can you please have a seat? This test I would then perform on the other ear. And Nicholas would repeat the 3 words again. All right, now we'll test your 9th, which is your glossopharyngeal, and we'll test your 10th, which is your vagus nerve. These are also both sensory and motor in function, and these deal with oral sensations, so taste and salivation. They examine the elevation of your pharynx during swallowing, and also speech, taste, and gag reflexes. So I'll be only doing the sensory test for this portion. Nicholas, I'll need you to please stick out your tongue, and I'll be placing a liquid. You're going to tell me if it's sour or bitter. I'll place this liquid on the posterior. Stick it out more, please. Open your mouth, and I'll be placing on the posterior aspect of your tongue. Can you please tell me what you taste?
Bitter.
Bitter. Very good. All right. Next, we'll go on to our 11th cranial nerve, which is the spinal accessory. This one is motor and function, and it deals with shoulder elevation and head turning. So, Nicholas, we'll be examining your sternocleidomastoid and your trapezius muscles. Can you please shrug your shoulders? Very good. Can you turn your head to the right? To the left. Excellent. Now I'll be adding some pressure. So, can you please shrug your shoulders? Turn your head to the right and to the left. Very good. Lastly is your 12th cranial nerve, which is the hypoglossal. This one is also motor and function, and it deals with tongue movement. It examines the tongue movements that are required for both speech and swallowing. So, Nicholas, I need you to please stick your tongue straight out. I'll be assessing to make sure that Nicholas's tongue doesn't curve and that it doesn't show any fasciculations or twitching, which it doesn't in this case. All right, Nicholas, put your tongue back in. Now, Nicholas, I need you to please touch with your tongue the cheeks that I touch with my fingers. Ready? All right, very good. Now, Nicholas, I'm going to apply some pressure, and I need you to push against my finger. Very good. I'll be assessing the strength with this test. Now, Nicholas, we'll go on to your cerebral functions. We'll be doing motor tests for this portion. So, Nicholas, we'll begin with your heel-to-toe assessment, your heel-to-toe test. So I need you to please walk for 10 feet, touching heel to toe. Very good. Now you can walk back, Nicholas. Heel to toe, heel to toe. Excellent. Next, we'll do the Romberg test. For this one, Nicholas, I just need you to stand with your feet together, your hands to your side, and close your eyes for me. Perfect, Nicholas, you can have a seat again. Your test was negative. If it would have been positive, you would have stepped out, and this would have showed an abnormal finding. Next is your cerebral functions. We will do the sensory aspect of these tests. So the first one is kinesthesia. This one deals with position. So, Nicholas, I need you to please give me your index finger and tell me where I'm moving it, whether it's up or down.
Up, down.
All right, do it with your eyes open first.
Up, down.
Very good. Now, can you please close your eyes and tell me?
Up, down, up.
Very good. All right, now we'll go on to stereognosis. This one deals with tactile discrimination. So for this one, Nicholas, I'm going to ask you to please extend your hand. I'm going to have you close your eyes, and I'm going to place a familiar object on your hand. All right, Nicholas, close your eyes, extend your hand, and tell me what this is.
Paperclip?
Don't open your eyes. Close your eyes, please.
Paperclip?
A paperclip. Very good. All right. Next is graphesthesia. This one also deals with tactile discrimination. So for this test, we're going to look at the ability for Nicholas to read numbers that are written on your skin. So, Nicholas, for this test, I need you to close your eyes again, extend your palm, and I'm going to write something on your hand. Please tell me what it is.
An 8?
An 8. Perfect. Very good. Lastly, we'll do the light touch test. For this test, I will be using a cotton swab, Nicholas, and I will brush this over your skin. So please, with your finger, follow the pattern that I do with this cotton swab. Ready? Close your eyes for me. Very good. Excellent. Very good. All right. Next, Nicholas, we will be going on to your deep tendon reflexes. So for this test, I'll be first assessing your biceps reflex. So for this, I will ask Nicholas to please rest his arm on my forearm. I will find his brachial, his biceps tendon, and I'll press on it with my thumb. I'll be using the pointy part of my hammer, and I will hit it slightly, softly, with the pointy end of my hammer. And I will be assessing for flexion of Nicholas's forearm. So, very good, excellent. Next, I'll go on to the triceps tendon. For the triceps tendon, I'll have you, Nicholas, suspend your tricep, holding your arm, very good, up, excellent. For this, I will need to find Nicholas's triceps tendon. I'll place my thumb on his triceps tendon, and with the pointy aspect of my hammer, I will also hit my thumb, and I will be expecting Nicholas to show some sort of extension in his forearm. Excellent, very good. Next is the brachioradialis. For the brachioradialis, I will hold his thumb, and I'll ask Nicholas to relax his forearm. I'll suspend his forearm as well. And with the pointy part of my hammer, I will slightly strike your forearm, Nicholas. And here I will be looking for supination and flexion of the forearm. All right, Nicholas, this will be supination. So here we go. Very good, excellent. All right, next we'll go on to our patellar reflex. For the patellar reflex, I'll have Nicholas sit with his legs dangling. I'll have him perform some isometric exercises. I will then push my hands together. I'll find his patellar tendon, and I will strike with the flat end of my hammer. All right, and here I will be expecting some sort of extension of the lower leg. Very good. All right, Nicholas, now we'll assess your Achilles tendon. For the Achilles tendon, I will help Nicholas dorsiflex his foot, and with the flat end of my hammer, I will find the Achilles tendon and I will strike the Achilles tendon. Here, I will expect some sort of plantar flexion of the foot. So, very good. Excellent. All right, lastly, I'll check his plantar reflex. For his plantar reflex, I'll need Nicholas to please sit down. His foot will be up. Now, with his shoes off, I'm going to trace a J upside down. And this J I'll trace upside down likewise. So I'll be assessing for Babinski's sign. Here, I should expect his toes to curl inward, and I should expect some sort of plantar flexion. So if I see any of his toes fanning out, or if I see some sort of dorsiflexion, I would expect an abnormal finding. So I would trace the J, expect inward curling, and plantar flexion. Now, in children who are not walking, fanning of the toes would be normal. Now, I'm just going to go over the lymph nodes, Nicholas, which is the last part of your assessment. All right, Nicholas, so for the lymph nodes, they should be soft, tender, rubbery, and movable. So they should not be hard, fixed, or painful at all. So first, Nicholas, I'm going to assess your periocular, which is in front of the tragus. Next, Nicholas, I'll go on to your postocular, which is behind the ear. Next, I'll go down to your occipital, which is in the back near your hairline. Then I'll continue on to Nicholas's submental node, which is underneath the chin. Next is the submandibular, which is along the aspect of the mandible. Next, I'll go on to the jugulogastric, which we will find underneath the earlobe. After this one, we will find the superficial cervical, which you will find this one on either side of the trachea. Next, you will find the deep cervical, which I'll ask Nicholas to please tilt his head towards me, and you'll find it along the aspect of the neck. Next, you will find the posterior cervical, which will be on the back on either side of the spine, and you will then test the supraclavicular, which I'll ask Nicholas to please hunch his shoulders, and I will palpate the groove of the clavicle. Next will be the auxiliary. The auxiliary you'll find in the armpits, under the armpit. The epitrochlear will be above the crevice of the elbow. And lastly will be the inguinal. With the inguinal, you'll find in the groin area where the leg meat is. All right, Nicholas, this is your assessment for today. Thank you so much for visiting, and thank you for your help.